What's up, guys? Welcome to BFR Tuesday. My name's Cara. I am your host, where I come on every week and answer questions regarding blood flow restriction training, whether in the rehab setting, the sports setting, or the fitness setting. Whether you're a clinician or you're a user or you're just trying to learn more about BFR, I'm happy to answer any questions that you got. If you have any questions, in your upper right corner, there should be a chat little icon or list, and you can just type in your questions. So I'm going to say, hello from Dallas. And that should just pop up and you should be able to see it. And I'll read your question and then I will hopefully answer it. And if I can't answer it, then I will find an answer for you. So I'll give everybody a minute to settle in. And if you want to just say hi, you can, just so I know who's there and where you're from. And then start answering some questions. Hello, Terry from Georgia. Michael from SoCal, nice. Hi, Sarah from Florida. Georgia and Florida, two places I want to retire to. Can't wait. All right, any questions from anybody? All right, I'll start chatting then. A couple things I've been seeing lately from folks that I consult with regarding BFR and their programming. Let me grab a cuff. So I want to make sure when we're putting the cuffs on, we definitely want to ensure that we have the cuff on and it's tight enough so that there's not a lot of slack in the cuff. So I put this thing up as high as I can. Okay. And then I'm going to tighten the cuff before I cinch it as tight as I can to start. Okay. And if you notice, I have it so the little stem is facing forward when I do this. So get it as tight as you can. You shouldn't be able to get any fingers underneath it, or at max one finger underneath it. And then keep that stem facing forward so I can easily plug in. So let me grab my pump. So this is the pro version of the smart cuff, but whatever kind of pump you have or manual pump. I'm going to lower my desk a little bit because it's hard to see. Okay, so I hit that little clip. I go on, super easy. If it's facing backwards, I got to reach all the way around. It's really hard. So have it facing forward. And then I start exercise. And then arm, I go to manual pressure, and I'm just going to choose my pressure because I already know what my limb occlusion pressure is. So I'm going to go to 82, which is 50% of my limb occlusion pressure. I'm going to hit start. It's going to inflate. And now I've got the cuff. It's inflated. I have two choices when I have the pro version of the cuff. I can either detach, which is what you're going to do if you have the consumer version of the Gen 3 pump and Doppler, or I can keep plugged in with the pro version and I can go to something called auto regulate. So auto regulate, you'll hear it. It's what it's doing is it's constantly regulating the pressure as I'm doing my exercise, which makes it, especially for the first few sessions, more comfortable. And it allows for kind of a continuous pressure versus, unless when I contract, if I'm here, I've got more pressure and it's going to feel much more intense. So the auto-regulation is a nice function to keep and maintain the pressures between the regions, like 60 to 80% in the lower extremity and 40 to 50% in the upper extremity. So that's auto-regulate. Okay. And then when I want to deflate, I just hit start new session, and then it deflates down. And so that comes off. So just as a take home, really make sure that that cuff is nice and tight before you inflate. And then you detach each time unless you're using the pro version with auto regulate. Okay, a couple questions. I'm rehabbing a pro mountain biker who's 4 months out from labral repair with bicep tendinosis. He has full range of motion and strength is coming along. I want to implement BFR into his program. Any thought on protocols for hypertrophy and strength for upper extremity? Sure. So since you're so far along now, when we're doing, what I would do if you've never done BFR with him before is do hypertrophy first for between 3 and 4 weeks. 3 times a week for 4 weeks. Do a hypertrophy phase, like a microcycle. And you're going to use higher pressures. So probably going to use something like, like day 1, I would do 40% limb occlusion pressure, see how he tolerates that. Day 2, 40%. Session 3, which is probably going to be the next week, 45%. Session 4, 45%. Then get to 50%. That's the max, so 50% limb occlusion pressure. But take a couple sessions to get there. Your loads are going to be super low, and you're not going to go to failure with those loads when you're working hypertrophy. So you're going to use higher pressure, lower loads for the hypertrophy, and then you're going to switch that after 4 weeks, and you're going to go higher loads. So you're going to be like, 35, 40% of the person's 1 rep max, but you're going to use lower pressure. So hypertrophy, we're going to use higher pressure, lower loads, and then switch that for strength. So hopefully that helps, Carrie. Michael, for maximal hypertrophy, would it be advisable to rotate BFR training with regular, more traditional weight training, or just stick with BFR? If you want maximum hypertrophy, like max, like the best that we can do, what I would do is 2 times per day hypertrophy training, not to failure. You can't go to failure. Just like I said before, you're going to use like 50% upper extremity limb occlusion pressure, and the lower extremity you're going to use like 70, 80% limb occlusion pressure. But you're going to use super light loads, and you're not going to go anywhere near failure. You're going to use loads that are, twice per day. If you want maximum effect, I mean, if you're okay with once a day, like if you're trying to do that for your whole body, I wouldn't do that. But if you're doing it for one isolated area, twice a day will only take you, 7 minutes each exercise. But you got to stress the tissue, and that'll get you your biggest growth. But you can only do that for up to 3 weeks. Like, you don't want to do it more than that. But that'll give you your max effect, and much faster than regular strength training. Regular strength training takes anywhere to 12 to 16 weeks to create hypertrophy. Hypertrophy with BFR should be, right around the 2 to 3 weeks. So that's for your max effect. And then of course you can back down or bump up depending on, how much time you have and all that type of thing. The other thing, X per day for same body part Yeah, twice per day for same body part. And I would do like 1, maybe 2 exercises, or do like, I don't know what body part what body part are you really looking for, Michael? Like you're thinking bicep, arms, legs. Okay, so then legs, what I would do isolated exercises. So I would do like a long arc quad or a quad extension. I would do, and then I would immediately after the first exercise, I would go to a hamstring curl. And then maybe session 2 that day, I would do calf raise and maybe do like a glute bridge. And so switch the exercises between the 2 sessions and hopefully you can take some time off between those 2 sessions, like 6-8 hours if possible. But if not, then just tax the tissue in 1 session. You're going to stick to probably about 3 isolated exercises for hypertrophy in a single training session, which would take you about 18 minutes then, because it's about 21 minutes with rest and everything. Because it takes about 7 minutes to go through an exercise, and 3 exercises, 21 minutes, so 2 sessions of 21 minutes. But you could alternate. You could do arms Monday, Wednesday, Friday. You could do legs Tuesday, Thursday, Saturday, and do each one twice a day, and you get a change for sure. And then during the strength phase, think more about isolated type exercises. I'm sorry, strength phase, think more about compound type exercises, multi-joint exercises. I also know some guys, haven't seen it in the literature yet, but people talk about doing supersets. So they'll do bicep and tricep. They'll go, if the normal set scheme is 30 repetitions, so they'll go 30 reps of a bicep curl, then immediately 30 reps of tricep extension, take a 30-second rest. So they're doing essentially a superset with the cuffs inflated. It's pretty tough. You're gonna have to keep the load light, which is good. Keep the load light, pressure's higher, and hypertrophy will follow. Make sure you have plenty of amino acids if you're trying to put on strength and size. If you're not getting enough amino acids, your body doesn't have the building blocks to create muscle. So I use a product called Keon, is amino acids that I recommend. I really like, and drink those during and after your workouts. All right, everybody, 1:15. That's about all the time I've got. Back to the clinic. Thank you so much. Some great questions today. Appreciate the attendance. And I will be back next week. See you soon. Bye.